So the rabies from sources other than dogs. Human to human transmission is through bites or saliva is theoretically possible but has never been confirmed. No cases are noted or no cases are found. Coming to next slide, clinical symptoms. The incubation period of rabies is typically 2 to 3 months. The late onset of symptoms you're going to see in case of rabies infection, but may vary from 1 week to 1 year. So depending on the factors such as the location of virus entry and the viral load, it will be vary. That duration will onset of the symptoms or incubation period will vary depending on the virus entry and the viral load. Initial symptoms of rabies include generic signs like fever, there will be fever, pain, and unusual or unexplained tingling, pricking, burning sensations at the wound site. As the virus moves to the central nervous system, once it enters into central nervous system, there will be progressive and a fatal inflammation of the brain and spinal cord develops. Clinical rabies in people can be managed but very rarely cured and not without severe neurological deficits. So once the clinical symptoms start showing, the person will definitely going to die, 100% fatal. So be aware of the dog bite and the rabies virus. Coming to next slide, there are two forms of rabies. Furious rabies, depending on the symptoms, we are going to classify these rabies into two types, furious rabies and paralytic rabies. Furious rabies results in hyperactivity, excitable behavior. The person will be hyperactive and the excitable behavior and the hallucinations, Brahma will be there, and the lack of coordination, then hydrophobia, fear of water. When you take water near to him, the person will be so much of fearful. And aerophobia, fear of drafts of fresh air. Even the breeze of air also make him fearful. Death occurs after a few days due to cardiorespiratory arrest. Death will occur due to cardiorespiratory arrest in case of furious rabies. Coming to second type, paralytic rabies accounts for about 20% of the total number of human cases. This accounts on around 20% of the total number of cases. Remaining 80% are furious rabies. This form of rabies runs a less dramatic and usually longer course than the furious form. Muscles gradually become paralyzed starting from wound site. Muscle become paralyzed from the starting part of the wound. A coma slowly develops and eventually death occurs. The person will end up into coma and death occurs. The paralytic form of rabies is often misdiagnosed, contributing to the underreporting of the disease. Because of the paralysis of the muscles, the misdiagnosis will take place. We are not going to diagnose about the rabies thing and viral infection. Coming to next slide, diagnosis. What is the diagnostic criteria for rabies? Currently, there are no WHO standard approved diagnostic tools for detecting the rabies infection before the onset of clinical disease. Before the onset of clinical disease, rabies, we can't able to identify the case as rabies infected. Clinical diagnosis of rabies is difficult without a reliable history of contact with a rabid animal or specific symptoms of hydrophobia or aerophobia. Without the symptoms of hydrophobia or aerophobia, it is very difficult to identify the case rabies infected person. The rabid animal or specific symptom should be there. Then only we can easily identify or diagnose the case as a rabies. Accurate risk assessment is crucial for deciding on PEP administration. This is one of the most important thing because post-exposure prophylaxis administration of the vaccine is highly indicated, but it is a crucial and accurate risk assessment is very crucial to decide the PEP. Once symptoms emerge, death is inevitable. Death is confirmed. He is going to die. This is end. 100% death will occur. Offering